So Sally, it's been 2 weeks since your diagnosis. Did you have a chance to talk to someone or read a little bit about it at all?
I did, but I'm still very confused.
Alright, feel free to ask me any questions if you have any at any time. Type 2 diabetes is something that can be managed through healthy lifestyle and diet. Imagine not having to drink any medications or having to give yourself insulin shots. How good is that?
Very good, as I was very worried about medications.
If this condition is not managed properly, it can have serious complications and it can even put you at greater risk of having cardiovascular disease. However, like I say, maintaining a good blood glucose level and by performing 30 minutes of physical activity can greatly reduce the risk of these complications from happening. So first thing first, how to maintain a good blood glucose level. Foods like breads and cereals, vegetables, fruits and dairy, they all contain carbohydrates. When carbohydrates are consumed, they're broken down in your guts to produce glucose. The pancreas releases insulin to decrease the blood glucose level. What insulin does, it binds to liver, fat, muscle, and other cells of your body and helps those cells to absorb the glucose and produce energy. If you look at it in this way, insulin being the key and the door being the receptor, insulin binds to the receptor, opens the door and allows the glucose to enter the cell. Without the key, the door wouldn't be able to be open and glucose wouldn't be able to go in. So in your case, it is either that the pancreas is not producing enough insulin or your cells are resisting its effect, or both. As a result, you end up having lots of glucose in your blood. This condition is called hyperglycemia. These might give you symptoms like feeling excessively thirsty, feeling like to urinate more frequently, and because your cells are deprived of glucose, you feel tired and lethargic. Type 2 diabetes can happen for a number of reasons, including being overweight, having type 2 diabetes as a family history, hypertension, and the risk of developing type 2 diabetes just increases with age. To maintain a good blood glucose level does not mean not having carbohydrates in your diet or having a low carbohydrate diet, but to have a carbohydrate diet that includes and spread the glucose, the carbohydrates, throughout the day. For your case, it means like having something for breakfast, morning tea, lunch, afternoon tea, have something to eat before you leave work to go home, and have something later that day when you get home. If you have your meals too far apart, this might give you a drop in your blood glucose level. This condition is called hypoglycemia. These might give you symptoms like shaking, trembling, inability to concentrate, and mood swings. Can you see how this can be a problem for you if you don't manage your condition well?
Yeah, I do.
Okay. Not all carbohydrates are digested at the same rate. Some carbohydrates are digested faster than others. These are called high GI carbohydrates. They give you a spike in glucose followed by a sudden drop. And this might make you feel like eating again, or in your case, hypoglycemia. Whereas low GI carbohydrates release the glucose nice and easy without giving you that spike in glucose. For diabetic patients, we recommend having good quality low GI foods. But you have to be careful. Not because something is low GI, you would have loads of it. You still have to spread your carbohydrates throughout the day. These might sound a little bit hard now, but believe me, by doing these simple changes, you will be able to maintain and improve your quality of life with a really big difference. Do you have any questions?
No, thank you.
All right, thank you.